Considering hair transplantation. Hello, male, 28 years old, considering hair transplant. How many grafts should I get? Should I do it now or wait 2 to 5 years? Do you know a specialist in Germany, or is Turkey a better choice? Thanks a lot. Best wishes.
Thank you for your question. You're 28 years old. You submitted a photo of the top of your scalp, and you're asking about choices about hair transplant, the usual questions about numbers of grafts, and as well as timing and location of where to get it done. Well, I can certainly give you my perspective when I see patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been a very big part of my practice, and I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed for non-surgical treatment of male and female pattern hair loss, and I think it will be relevant to what your question is at this point. So when patients want to have hair transplants, and it's very natural to be concerned about maintaining a certain appearance, but when I see a younger person like yourself who has a significant amount of diffuse thinning, and which means that there's a lot of hair that's lost and you're only 28 years old, I think the more important question is how can you stop or slow down the progression of your hair loss? You see, hair transplant is a very good solution for treating areas where there's hair loss. However, there are significant limitations. And traditional hair transplant, not counting body hair transplant, but transplanting hair from the donor area, the back of the scalp, where whether you're a man or woman is permanent, you can only cover so much. And it is not unusual for us to see patients who have had 2 to 3 or even 4 or more transplants who lost a lot of their native hair, and they just have this fine, thin hair and very little coverage, and they don't look like they've got a lot of hair. In fact, they look like they're losing hair. So I generally tell patients who are in your age range is, what can we do to help stabilize your hair loss or slow it down? Well, medically speaking, or pharmaceutically speaking, I should say, you can consider a drug like finasteride. Finasteride is a drug that you take once a day, and it reduces the level of something called DHT, or dihydrotestosterone. The challenge is, of course, to take it daily, and the other challenge is it may or may not be effective for you. The drug does reduce DHT, but there are certainly a spectrum of how much is a person's hair is DHT sensitive. So, nonetheless, I still suggest considering this drug, even though currently there's a lot of fear about the potential of long-term sexual side effects. Clinically speaking, in my practice and prescribing it since 1997, and talking to my colleagues and going to meetings and discussing this for many years, especially more recently, we still feel that it's my perception is that sexual side effects occurs very infrequently, and that overwhelmingly patients are able to tolerate the drug. Very often they don't realize that other issues can be causing certain sexual dysfunctions, be it stress, lack of sleep, poor nutrition. A lot of things can be a factor, but it's very easy to often blame a single pill. I often tell our patients that try and do a trial of this drug for a few months, and if you can tolerate it, then you should be able to tolerate it more long term. Now, this certainly is a controversial area now, and a lot of times people are very afraid to still take it. So we actually developed Hair Regeneration around the same time that there was a lot of fear about the long-term sexual side effects of finasteride. So a lot, if not the overwhelming majority of our patients were not taking finasteride. And with Hair Regeneration, we were able to established several things, and which were very successful. We were able to stop the progression of hair loss. We were able to reactivate hair that wasn't growing, as well as prolong the growth cycles of the hair so that the hair continued to grow and sustain for about 5 years. Now, hair regeneration is a system we developed using a combination of acellular matrix, which is derived from pig bladder. It's used for wound healing, and I use it in a lot of my other cosmetic surgical procedures. And this is combined with platelet-rich plasma, PRP, and we've developed a very, based on, again, we started this over 7 years ago. Through rigorous measuring, we were able to develop protocols for different types of hair loss. And so it's also a system of injecting and dosing, which was critically important to achieve the kind of results we've been getting. Essentially, 99% of men and women have favorable responses. And again, and it's important to establish the proper diagnosis, but generally speaking, over 95% of hair loss in men and women is genetic pattern loss or androgenetic alopecia. So I would say before you're ready to do a hair transplant, learn more about the use of finasteride to slow down progression, as well as technologies such as what we've developed with hair regeneration, because it is important to be stable and maximize the amount of hair you have before you move on to transplantation. Understand there are limits. So I hope that was helpful. I wish you the best of luck. Thank you for your question.